everybody. Welcome back. 7:30, breakfast today with Sally Nugent and John Kay.
This morning, the government has published its long-awaited suicide prevention strategy for England, which aims to reduce the number of deaths within 2.5 years.
There are more than 100 proposals in this new document, and here to discuss them with us here on Breakfast is the Minister for Mental Health, Maria Caulfield. Good morning. Thank you for joining us. I was just looking, it's exactly 11 years ago to the day since the last suicide strategy. In the meantime, many lives have been lost. Why has it taken so long to come up with this one?
Well, it's really important to note the progress that's been made during that time. We saw a 20% reduction in the number of suicides compared to, say, 2 decades ago. But really, since just before the pandemic, that progress started to plateau. So we haven't seen a huge increase in the numbers, but we haven't made any further progress in reducing the numbers. And that's why we're bringing forward the strategy now, because we have roughly about 5,000 deaths by suicide in England each year. And we know that there are particular groups of the population that are more at risk. Middle-aged men, for example, are at a higher risk than the average population. And so it's important to bring that forward now so we can keep on with the progress of reducing that suicide rate further.
Yeah, you say that the rates have stalled generally since 2019, but the rate of suicides among young people, children, have actually increased, haven't they, in the last few years? You say you want to bring those numbers down within the next 2.5 years. I'm just by how many and why 2.5 years?
Well, we want to see the numbers reduce as quickly as possible, and if we left it to the end of the strategy, which is a 5-year strategy, as you say, many lives could be lost, and we want to save as many lives as possible. And we know, and there's work happening already around some of the high-risk groups. So, for example, it's the leading cause of death in new and pregnant mums, which is a shocking statistic that suicide is the leading cause of death in that age group. But there is work going on in terms of setting up maternity facilities across the country now to support new mums. And we want to make suicide everyone's business. So it's not down to just health and social care to make the difference here. Everyone can. And we know for middle-aged men, for example, 2/3 of those who take their life by suicide have been in touch with a public-facing organisation in the 3 months leading up to their suicide. And so just simple measures about knowing who's at risk, the sort of pressures that can trigger their intention for suicide, and then just simply asking people if they're okay, helping them with whatever problems they're facing, whether that's DWP, for example. We're rolling out training for staff there so that if someone's in contact with them, they can spot the signs and symptoms and then know the sorts of measures that will try and point them in the right direction to get help and support.
So have you got a target? Do you want to get the number down to a particular number?
I mean, I've taken advice on this from a range of organisations and stakeholders and charities and our national advisor, Professor Lewis Appleby, and they don't feel that a specific target, a number, is helpful. They want to get it down to as low as possible, and there will be different interventions depending on the high-risk group. So, for example, people who've lost someone to suicide, bereaved families and friends are also at risk, and it's about helping employers, helping society support people when they're experiencing bereavement because of suicide, and knowing that they may need extra support to get them through the months and years ahead. So there's different interventions for different groups of people who are at risk.
You mentioned support. We hear on this programme from people so often that the demand for mental health services is so high, and often people have to wait months and years to see someone. Do you have enough staff to provide that kind of support that people clearly need?
Well, in our manifesto, we pledged to increase our mental health staff by 27,000. We're going to meet that target. We're already over 20,000, but we've seen a tsunami of people coming forward asking for help. So, we've broken many of the taboos and stigmas around mental health and mental illness, and we've encouraged people to be open and honest and talk about it and come forward to get help. But it is true that there are pressures in all parts of the United Kingdom in people trying to get that access and help. If you look at our Every Mind Matters website, which is on the NHS website, and I encourage everyone, whether you're experiencing problems or not, to go and look at that. There's a range of support and measures, and people can self-refer for talking therapies. And just this year alone, we've seen 1.2 million people self-refer for talking therapies via that website. That shows you the scale of need that's there. So we're putting in extra funding, £2.3 billion extra a year into mental health services. But it is a challenge, and we're being honest with people. It is a challenge to meet that demand, but we still want people to come forward and ask for help if they're experiencing difficulties.
Here on Breakfast, we've heard frequently from the Three Dads Walking, three dads who lost their daughters to suicide. And they've been campaigning for suicide prevention to be part of the school curriculum, the national curriculum. I noticed that this strategy talks about that more and says the Department for Education will look at that, but there's no actual commitment, is there?
Well, this is a cross-government approach. So whether I talked about DWP earlier, but yes, the Department of Education is key, and we are working with them in terms of the school curriculum and getting mental health and suicide awareness onto the curriculum, but also with universities, because when young people leave home, go and start a new life, often lose some of their usual support mechanisms, university can be a pretty lonely place. They're often then faced with financial pressures that they probably weren't used to before. And so it's about schools and universities, and that's why we're rolling out mental health support teams in schools. So we've got 400 already in place. We want to increase that to cover 50% of schools by just over a 12-month period. And we're supporting something like 3 million children now with those mental health support teams. And teachers are saying to us the difference that's making, not just in providing mental health support, but by raising awareness of what good mental health is like, and asking for help if you're coming to a point of crisis or periods of challenge in your life. And teaching young people how to cope is fundamental going forward in terms of reducing that suicide rate.
I know that the Three Dads and other campaigners will welcome the fact that there is a suicide strategy, but some people will say that's the final part of this, that there's a bigger picture as well, that people are worried about their cost of living and health concerns and education pressures, and that the government should be tackling the causes, the root causes, not just the last end game.
No, absolutely. I've met with the Three Dads Walking in Parliament and heard from them firsthand about the changes that they feel would make a difference. And I think they've welcomed the suicide strategy and the measures particularly around schools and universities that we want to drive forward. But we do know that financial pressures are one of those key risk factors in terms of tipping people towards thinking of suicide. That's why it is a cross-government approach. You know, there is help and support available. Often I see constituents in my own surgeries that are maybe facing pressures with mortgages or loans. And when you get them the help and support with banks or other organisations, whether it's utility companies, you can reduce their monthly outgoings and improve their cash flow. But the first step is coming forward to ask for help. So the help may not always be mental health support. It may be actually dealing with their practical problems that are causing so many pressures. And I think that's why we need to raise awareness that suicide is everyone's business. It's not just a health issue. It's about some of those practical everyday pressures that people face, that if you can make that a bit easier for people, their risks of suicide do diminish.
Health Minister Maria Caulfield, thank you for joining us here on Breakfast. And we're going to be hearing from Mike Palmer, one of the three